Incoming.
Welcome to The Bunker. Bunker Bros is an active duty and veteran nonprofit. We're focused on ending veteran isolation, which is the number one cause of veteran suicide. We're doing this through creating an app, a social media outlet for veterans to talk, gather resources, and communicate in a community that understands. If you're looking to donate or get involved, please visit www.bunker-bros.com.
Episode 1: The Brain.
Post-traumatic stress disorder is one of the most common and least visible injuries of war. For many veterans, it doesn't end at homecoming. It follows them into daily life, into sleep, relationships, and work. PTSD can show up as hypervigilance, nightmares, panic, irritability, and emotional numbness. Ordinary environments can feel unsafe. Over time, many veterans begin to withdraw. They avoid crowds, avoid conversations, and avoid people closest to them. Post-traumatic stress is also accompanied by many other health risks: depression, insomnia, chronic pain, TBIs as traumatic brain injuries, and substance abuse. Suicide remains a devastating reality in the veteran community, and PTSD is often part of a larger picture. There are evidence-based treatments, including trauma-focused therapy and medications such as antidepressants. Many veterans benefit from them, but others don't get enough relief or struggle with the side effects, access, or the demands of treatment. For some, the search for something else continues. This is now driving new research. At Wayne State University, clinical trials are examining whether cannabis, specifically cannabinoids, may reduce certain PTSD symptoms, such as sleep disruption, intrusive thoughts, and anxiety. In Michigan, cannabis is legal under state law for medical use, and for legal adult recreational use for people 21 and older. Under federal law, cannabis remains illegal as a Schedule I controlled substance. That conflict shapes research, policy, and personal risk. Bunker Bros took a trip to Wayne State University in Detroit to meet the professionals behind the research in the study. Burke and Ben got to interview and tour with the men and women trying to make a difference in veteran lives. These documentaries will follow the science and the people inside the legal and medical crossroads as researchers ask a straightforward question: can cannabis provide measurable and safe relief for veterans living with PTSD? I'm Burke. This is Ben.
Nice to meet you guys. I'm Becca.
So you're doing the actual screening for the participants?
I did, yeah.
Oh, yep. Very cool. How many do you have so far?
16, I think, right now.
And then they all started the trial?
No.
Okay.
We've had only like 3 people that have been eligible for the actual study. 2 people weren't answering us anymore, but we actually just completed another visit today for the actual study. So only 1 person currently enrolled.
Okay. And how far along are they?
They just did their 2nd day of baseline, so they pretty much just started. They haven't started the actual treatment yet.
Okay, very cool.
Yeah.
It's going. You should see our bus outside. That'd be a good shot.
Is it a van?
Yeah,
I parked next to it. I was like, that's a veteran.
Yep, that's ours. Yep, the cannabis.
Becca will go and start driving it for you guys.
Okay. Cool.
I want to take a tour to Detroit.
Yeah,
absolutely.
And then this is just our conference room. We, as you can see here, this is our timeline. This is more of like a visual understanding of what we do at each of the visits. I know it looks really confusing when you first look at it, but as you go more into the study, it becomes a lot more digestible. But as you can see, we do our treatment for 12 weeks, and during each week, there's different types of assessments that the participant's going to have to do, and then they have them come back for post-treatment follow-up visits.
Okay. I see that breathalyzer on there.
Yes.
Every single room. Is that just to make sure there's no alcohol in their system, or check
Yeah.
something else?
Yeah.
Okay.
Yes, perfect. Good. Do you want to work here?
No.
Okay. Okay.
Well, it makes sense.
That's pretty consistent throughout all of the studies in this floor. We always do a breathalyzer at every visit just to make sure that check the alcohol content in their system. We also do a ID check to make sure that they're who that they say they are, and then we do a lot of times we do urine analysis, and that's again for drug panels and things like that.
I see the cannabis administration. How do you admit?
Yeah.
We actually just did our first cannabis demonstration today, so that was really exciting. I was one of the only RAs that actually was able to see it. So it's Dr. Leslie Little. She prepares the cannabis the day before, and then she kind of guides the participant with making sure that they're breathing the right amount, and then they're holding for the right amount, and then they're exhaling for the right amount. So they kind of walk you through it through a walkie-talkie. And that's something that's really interesting about working in this study, is that we are seeing a lot of, at least the people that we're talking to, veterans are smoking, and they use it constantly. And I think that we've gone to so many recruitment events. We've gone to the War Memorial. We've talked to a lot of older veterans, and I thought that they would be a little bit more like reserved when it came to cannabis, but they were smoking even when they were serving like years and years ago. So I thought that was really interesting.
There's a weird gap. So you see the Gulf War dudes and the dudes right before them, they're like super into it, but then the early 2000s to mid 2000s didn't really do it, and now it's becoming more of a thing.
Exactly.
Now all of our soldiers are probably active.
Which is quite interesting to see what that is, like if it's a generational thing or just the time that you served, where you were located. So we're constantly asking ourselves questions in the lab.
Is it still, so they all smoke for this trial?
Yeah, so that's the goal, is that they're smoking whatever dose that they were assigned to. So no one knows. It's a double-blind clinical trial, so we don't know what dose our participant today got, and they don't know what they got. And then they smoke throughout their trial whenever they feel any sort of PTSD symptoms or anxiety or depression. That's kind of the goal, is to use that almost as a therapeutic sort of treatment and see if it's valid.
Okay, so the day-to-day, let's say they have a great day, no PTSD, no anxiety, anything like that. Would they still smoke that day, or they just wait for it to happen?
Yeah, I think that's also one of the interesting parts of the study, is we don't really know how veterans are going to be using this cannabis. We hope that it would kind of lead towards that way, but it could just be for pleasure, and that's something that we're also taking into consideration too. Not everyone that we've spoken to, we've now added a questionnaire on our pre-screener asking why they use cannabis products. So that's been really interesting, because it's not just, whether it's PTSD symptoms or anxiety or depression. Sometimes it can be for chronic pain, sometimes it can be for pleasure, sometimes it can be just a social thing. We know a lot of people who go to their friends over the weekend and then they're smoking during that time, because they're with friends and they're celebrating, or especially during 420, we saw a lot of people smoking.
So it's just kind of like a day-to-day as each individual. It's okay.
Exactly. I feel like with cannabis it's a little bit harder. I think just any drug and substances, it's kind of like a very flowing sort of path. I don't think there's one sort of a link with it.
It's not like cigarette smokers every hour.
Exactly. I feel like nicotine's a little bit easier too.
Oh yeah.
But cannabis is so open.
So you have one person that's currently starting the trial. I think you said you administered their first dose today.
Yes.
Now, are they supposed to or not supposed to get outside cannabis?
Yes.
Can they go to the store and buy?
No, you're right. They're not. That's part of the requirements of being in the study, is to only smoke the cannabis that you're getting from the study.
Okay.
However, I mean, we're not the police.
We can't stop you.
We can't stop you.
Please
We'll try to stop you. So I think it's just, we highly encourage it.
Yeah.
And, I think with veterans, it's very interesting, because they are very strict, if they're kind of told something, I think they have a very high honor.
Depends on the person.
Yeah, it depends on the person. But I think for a lot of people we've seen, they've been very, very understandable, I guess.
Here we are at Wayne State doing a tour at this research facility where they're going to start doing trials on CBD and cannabis and its effect on PTSD. So what is the endocannabinoid system, and why does it matter that our brains have?
I know, it's a mouthful, right?
Yeah.
So, scientists suck. We have long, weird names.
Oh, I just can't read.
No, you're fine. So the endocannabinoid system. So cannabinoid are different constituents or components of the cannabis plant. So the the two most common and well-known are THC and CBD, right? So those are called cannabinoids. That's like their chemical type. But of course, there's hundreds of different things in the cannabis plant. It's not just THC and CBD, and there's varied levels, which is why, you could take one type of cannabis flower and then, use it, and then you do a different one and you get totally different effects, right? Because they're totally different plants and different constituents. So the endocannabinoid system is the endogenous, or meaning natural to ourselves, the system we have in our brain and bodies, which cannabis interacts with, which is how it has its effects on the brain and the body, right? It makes people feel high and has potential, anti-pain, anti-anxiety effects. But we don't have this whole system in our brain and our bodies just so we can get high. It actually does a variety of what we call really core kind of homeostatic processes, like sleeping and feeding behaviors and stress regulation. And my background is more brain development. It turns out that this system is really critical for how our brains are developing, in the womb and during our teenage years and actually across the lifespan. So it's basically how cannabis interacts with the brain and the body, and studying this system in general.
Okay. So how does it normally handle stress and fear, the things that go haywire in PTSD?
Right, yeah. So we actually produce our own natural versions of things like THC and CBD, and those are your endocannabinoids, and these are small molecules that are produced by the body. They're actually like fatty or lipid molecules, and their job is to come online to help us regulate stress. So if I'm stressed out right now because you're giving me really hard interview questions, then hopefully my body is producing endocannabinoids to help me respond to that stressor. Same if you're experiencing a traumatic event. We think that this system is really important for coping with stress, helping us to adapt from stress and recover from stress. And that's why the system is really interesting for things like PTSD, where we think that there's some sort of dysregulation in how this system is responding to stress. Hence why a lot of people who have PTSD self-medicate with things like cannabis, which we know directly impacts the system.
So, make sure I'm understanding.
No, you're fine, yeah.
Let's say I have anxiety. I have a weird trigger in my day-to-day life that makes me feel anxious. I get the pounding heart,
Sure.
hard time breathing, stuff like that. Is that somehow connected, maybe a deficiency in something that you're talking about?
Yeah, that was the original theory of endocannabinoids, was that people with anxiety and other stress-related disorders like PTSD, they just produce less endocannabinoids. Turns out with science, it's not always that simplistic. A lot of actually the treatments that were being explored and currently being explored, they boost endocannabinoid concentrations, because you think if like producing more stress, kind of buffering, molecules would help you kind of recover from anxiety. Turns out that didn't really work out. There's a couple trials that recently failed for PTSD that do exactly that. I think it's a little bit more nuanced than simply just raising the levels, but that was the idea. And I think it's very like person dependent and like context dependent, right? Because you don't just naturally need to dial up your levels every single day. It's only when you're being acutely stressed. Like if you've got an exam coming up, you really need to have that regulation. So.
Okay. What goes wrong with the system in people with PTSD or severe anxiety?
Yeah, that's like the $1 million question. So a lot of the animal studies where they were trying to mimic what happens with PTSD, where there's this kind of like persistent fear response that's really hard to shake. And I will say that response is really adaptive, right? Because if you've been exposed to a trauma, your brain and your body doesn't want you to go anywhere near that event, and that's for your survival. So that's a very like that keeps us alive. But with PTSD, we think that ability to kind of regulate that fear response when you're coming back from deployment, for example, when you're driving around in Detroit, having that kind of response is no longer adaptive. So it's very like context dependent. So with PTSD, we think that there's some problem with fear memory kind of maintenance, and endocannabinoids are really important for that. They're helpful for saying, okay, this is safe in this context or in this environment, and this might not be so safe. So a lot of the animal models showed that this endocannabinoid system is really important, which gave us this really brilliant idea that if we just boost endocannabinoids, then we can potentially treat PTSD. When that was brought into the clinic and actually tested in people with PTSD, it was an epic failure. It had no effect. Yeah, so that was kind of one angle. There is evidence still, and we've shown this too, that even kids with PTSD symptoms, if you measure in their blood samples their levels of endocannabinoids, we're actually seeing the opposite. So it looks like they're producing too much endocannabinoids at rest. But the idea is that if you expose them to subsequent stressors, they're not able to kind of appropriately ramp up that stress response. So it's almost like, I think of it like a thermostat. Like in PTSD, it looks like it's dialed way too high, maybe because of the long, chronic stress associated with PTSD, so that when they encounter more stress in their day-to-day lives, their system isn't able to cope in the way that it should. So that's what I was alluding to, that it's probably more of like a very context-dependent thing that's happening, and we just need a handle on how to address that.
So it could be too little or too much.
That's right.
Getting the same type of, okay.
Yeah, and I will say this is all kind of oversimplifying, right? Because cannabinoids are across the entire body. Like they're working in the periphery to control things like immune functioning, feeding behaviors, temperature regulation in the body. Like everyone's heard of like cannabis and the munchies too. But then in the brain, they're working in like different brain areas and different processes. So it's not just like a simple like turn up, turn down. It's like very specific brain areas.
You're helping running these veteran cannabis studies. Tell us about them and your role.
Sure, yeah. So they're really exciting studies you'll hear more about. But my role is as the neuroscientist trying to study like how and why cannabis might work. A lot of people, self-medicate or say they use cannabis to help with anxiety, to help with sleep. But in reality, there's very little actual empirical research data to support that. So what these studies are doing, and which is why I love them, is actually showing, in a really rigorous scientific way, like, okay, does this help, and does it help for certain people, in certain ways, right? So it's actually putting some science behind it. So we're looking at whether these different components of cannabis, how they interact with our own endocannabinoid system, which we think, again, is kind of disrupted in PTSD. We're looking to see if we can see what's happening in the brain. Here's my little brain, 3D printed brain. We give a lot of our participants actually like their own brain. So this is my brain. There's a lot of damage on it, so don't look too closely.
It's actually yours.
It's my brain, yeah.
That's cool.
It's from an MRI scan. So we do scans of people. We can actually look at like brain structure, so size of different areas, and how the brain is responding to different stimuli.
No smooth brains here.
No, yeah. It's pretty damaged though. That's another story. So we can actually look to see how cannabis affects the brain, and does it kind of correct some of the imbalances we think are associated with PTSD. And that's really important because we need to understand how it works to be able to optimize cannabis treatments, because it's really hard to, prescribe like certain ways of using cannabis. So we want to use it for more like, does it actually affect the brain, and how so, and how can we better optimize that treatment?
And what is your role?
Doing the brain imaging part. So
okay.
We're scanning brains. We're looking at brain measures of inflammation, and inflammation is involved in basically everything. But PTSD, there's some really interesting studies showing that it's involved with PTSD. And there's also research just suggests that that's how cannabis might be therapeutic, is by reducing inflammation in the brain. So we're able to test that directly.
So you see a lot of TBIs.
We do. Yeah. I mean, that's pretty common, right, in military.
Yeah, extremely common. Why not just give people cannabis and ask if they feel better? Why scan the brain?
Yeah, I think the brain gives us really specific insights into, again, like, how is this changing the biology, and is it actually affecting the brain circuits we know are important for PTSD? And again, I think we need to understand how it works so we can better, optimize it for people. Because right now in psychiatry, we're in a psychiatry department right now. A lot of the treatments we have, for example, antidepressant treatments, it's like trial and error, right? You go into a psychiatrist's office, they might have you take Prozac and see if that works for you. But it's not like you can just go home and try it overnight. Like, it takes multiple weeks to be able to have a treatment response. And then if you don't respond, which is about 50% of the people, then you have to taper off the medication and then try a new one. And if you're really suffering, like if you have PTSD, you can't wait weeks or months to find the best treatment that works for you. So I think that's the promise of what we're doing, is if we have some sort of brain imaging or biomarker that we can predict, okay, you're going to respond really well to a high THC formulation of cannabis versus you would respond, another person who would respond to high CBD, like that would save time and potentially lives, right? If these people are really suffering.
What can a brain scan tell you that a symptom checklist can't?
Yeah, if there are going to be biological effects, right? Is it only, because I think everyone's been in the place where I know I am, where I like say I'm not anxious, but like my heart is pounding,
Yeah.
right? So I think it tells you a little bit more about what's happening kind of under the hood in your biological systems, and if it's gonna last longer. Because if you see that cannabis, for example, changes the way that the brain is structured or how it functions, then you might have lasting effects.
What brain changes signal that someone has PTSD before treatment even starts?
Yeah, that's still being hotly debated. I think one of the most common things we find when we scan people's brains with PTSD is that an area of the brain called the hippocampus, which is also susceptible to TBI, is shrunk. It's smaller in size in people with PTSD versus people without. And there's a lot of this is again oversimplification, but that's one of the kind of hallmarks and features of PTSD. And the hippocampus is really important for learning and memory and emotion regulation. So you can kind of see how that kind of maps onto what we think about PTSD. But that's why we're looking at cannabis to see if it actually can increase size of the hippocampus or kind of reverse some of the other effects of PTSD.
Is there anything that says that it would in previous trials anywhere? Do you know of?
Leslie and Dave can tell you about it. It's really hard to study these types of things because of the federal regulations. Cannabis is still a Schedule I drug. It's really hard for researchers to study. So as far as I can tell, no one has ever looked at it in neuroimaging, so people's living human brains while they're getting a cannabis treatment. There's been acute dosing studies. So they'll put people on a scanner, they'll give them an acute oral dose of THC and see what happens in terms of the brain. But no one has ever given in a randomized clinical trial, so the gold standard way, actually testing how cannabis affects the brain and the body.
After cannabis treatment, what would you hope to see change in the brain?
Yeah, I think a lot of the reversal of what we see associated with PTSD. So we already talked about some of the brain structural changes. We don't know if they're going to change in 12 weeks, but a lot of the way that the brain functions, and especially how it functions in response to threat. So that's one of the core kind of problems of PTSD, is that there's this hypervigilance for threats that things that people without PTSD might not perceive as threatening, triggers this trauma or this fear response in individuals with PTSD, and it's really easy to trigger. So there's brain systems, regions like the amygdala, that's important for kind of detecting threats in the environment, that we think is hyper responsive in PTSD. So we're hoping if cannabis is effective, that it would kind of turn down activity in those brain areas so that they would be less kind of hyper vigilant.
Can brain scans predict who will actually benefit from cannabis versus who won't?
Yeah, that would be amazing, right? So we're looking at brain scans. We're also collecting blood levels so we can look at whether a person's kind of endocannabinoids can predict treatment response. We're also looking at, if you give someone the same dose of THC, that the way that the body metabolizes that is totally different based on genetics and age and all of these other things. So we're looking to see if their kind of body's ability to process that in the blood predicts treatment response too. So we're hoping to find something.
Yeah. Guy's got a small hippocampus, needs cannabis.
Yeah. It's possible. That would be the dream, right?
Yeah. THC gets you high, CBD doesn't. But what are they doing differently in the brain?
Yeah, that's a great question. So cannabinoid receptors, so how THC works on the body, are all over the brain. THC binds directly to those receptors in the same way that our kind of natural versions of those molecules do. So they mimic a lot of the stress reducing effects that our own system does. CBD is weird. I think of it as kind of like a promiscuous molecule. It doesn't bind directly with those same cannabinoid receptors in the same way that THC does, which is probably why it doesn't get you high. It has variety of physiological effects. So it binds to a lot of different types of receptors. and some of them we think are important for reducing anxiety. There's actually this building right across here, so the people on video can't see, but we're directly across from the Children's Hospital of Michigan. We have partnered with them for years because they have
giving them THC.
No, yeah, children, they would shut us down. Don't get it shut down. That's a good punchline. CBD, actually. So we've been giving them CBD for years, and these are kids with treatment-resistant epilepsy. And these are really severe cases. These kids are having hundreds of seizures every day. Oh. And CBD seems to be one of the things that helps to control their seizures. We don't totally understand why, but it does have this ability to kind of turn down excessive neuronal activity, which is a hallmark of epilepsy. It's this like electrical storm in the brain that you can't control. And there's a lot of, I'm bringing this up because there's a lot of parallels between epilepsy and anxiety, and that with anxiety, we kind of have this uncontrolled kind of limbic activity where the brain is really worried and hypervigilant, right? It's like this intense emotional response. And we're seeing some signatures that CBD might actually help to kind of control that in the same way that it controls epilepsy. So it's very intriguing. No one really understands how it works in epilepsy, but it seems to work very well.
What did you say the success rate would be?
Oh gosh, it depends on the study. I don't know the rates off the top of my head, but we're doing a study right now that I think we're going to chat about in a little bit, where we're looking at CBD for people with anxiety disorders. And it's a randomized controlled trial. We don't know who got like the active drug versus the placebo yet, but in the like handful of people that have completed the study so far, we're seeing a significant reduction in their anxiety symptoms. So some people are moving from like needing clinical intervention to below the clinical threshold. So it's really promising at this point.
Fantastic.
We'll have to come back in a year or so.
Yeah. Do a follow-up,
Exactly.
Yeah. We'll have to come up with a cool name for the series or something.
Yeah, definitely. Sure.
Can you briefly describe Epidiolex?
Oh, Epidiolex. Sorry.
Could you do that?
Yes. Epidiolex is currently the only FDA-approved CBD medication we have on the market. Everything else with CBD is an unregulated supplement, so this is actually a medicine that we're able to use in clinical trials.
And so being an FDA-approved CBD doesn't have the THC aspect at all.
Right. It's an isolate, so it's technically derived from the whole plant, but they basically extracted all the THC out because you don't want to get THC, as you alluded to before.
Gotcha.
Yeah, there you go.
So like I saw this, but that would be why the whole plant cannabis is different, because it's not extracted.
Exactly.
Okay.
Yeah, and they make like tons of different types of CBD products. You probably seen like they have isolate versus broad spectrum versus full spectrum. Yeah, it's a crazy market.
Everyone was like freaking out. Like active duty troops were freaking out when CBD came on the line because like I'm going to use soap and it's going to make me high.
Oh.
I'm going to pop hot and be kicked out of the army.
Oh my gosh. Well, it is actually possible to test positive, and a lot of the CBD supplements aren't labeled. So you'll buy something that says like 0 THC and then you test positive because it actually has. So they're not labeled correctly. Is what
we had a problem with Kind Bars had a
lot
of, what was it, poppy or something?
Opium poppy.
And dudes were popping hot because they would get the poppy ones that would pop hot on drug tests and be like, oh no, are all of our troops on heroin?
Yeah, who would have thought Kind Bars?
So yeah, we weren't allowed to eat Kind Bars for like a really long time.
That's crazy.
It's crazy.
Wow.
So PTSD means your brain can't unlearn dangerous past. How long does it endocannabinoid?
You're doing great. Endocannabinoid.
How long does the endocannabinoid system normally help with that?
How long?
How does the endocannabinoid system normally help with that?
Yeah. It comes online in response to stress, and it's actually like even before we're born, it's kind of wiring up the brain in a lot of ways, but it's present throughout the lifespan. So actually the fastest growing population of people using cannabis is aging adults. And so it seems to have some interesting kind of mood stabilizing, maybe anti-aging properties in older brains that we don't see in younger brains, where it's actually detrimental.
So like you're being serious, like anti-aging brain.
Yeah.
Oh, I thought it was a joke.
No.
Like it makes old people young.
No, yeah, there have been a couple of studies, and it's really hard to study, and they're all like people who say they use cannabis, and you kind of follow them over time. It's not like in a rigorous randomized controlled trial way, but anytime the brain is developing, we've seen that it's really sensitive to cannabis. Like cannabis is not good for developing brains, but on the opposite side of the lifespan, it looks like it actually might be kind of neuroprotective through the aging process.
Oh, wow.
This is also very preliminary data, but it's kind of encouraging.
Could you describe your Calm study?
Sure. Yeah, that's the anxiety study that I was mentioning. So we're looking at CBD to see if it does have effects on anxiety. Because I think CBD is something where everyone's like, oh yeah, I take it for stress or anxiety. But like cannabis, there's not a lot of like, empirical research to support that it actually does have anti-anxiety effects. So these are people with anxiety disorders coming in, and we're trying to see if CBD can kind of augment the effects of therapy, which we know works really well, but not for everybody. So again, we'll have to have you back up here to see if we see some problems.
Yeah, we'll mark it on the calendar.
Awesome.
Set up right now. Why not?
Yeah.
All right, so you're studying cannabis for anxiety more broadly. How is anxiety different from PTSD in terms of brain change?
Yeah, it's very similar in a lot of ways. So the way that psychiatrists diagnose PTSD or anxiety was something called the DSM. Have you heard of that?
Nope.
It's like I have one over there. It's that big blue book. It's like this big for people who can't see. It's the Diagnostic and Statistical Manual of Mental Disorders. Again, big like jargon. But it's how basically psychiatric disorders are defined. And PTSD and anxiety used to be under the same category of an anxiety disorder until the most recent version of this book, where PTSD was kind of plucked out into its own category called trauma and stressor-related disorders. Because of all the psychiatric disorders like bipolar, depression, schizophrenia, PTSD is really unique in that we know when it starts. Like you have to have a traumatic event. And like for a depression diagnosis or anxiety, you don't need to have that, right? It's just you get diagnosed. So there's a lot of like similarities in terms of kind of that hyperarousal state. Like if you feel worry, negative view about yourself or the future, a lot of those are really signatures of anxiety, that kind of like hyperarousal, startles easily, very jumpy. And then there's some different components to PTSD, especially like that trauma response. Like you need to have a trauma. And then one of the theories of PTSD is that everyone in the wake of a trauma has PTSD, but most people recover. So it's like, why do only a subset not recover over time? So there's a lot of similarities, a lot of differences.
Yeah, especially in our world. Sometimes guys go on their first deployment, combat deployment, and they'll be totally fine with everything that happens. And then second one, third one, fourth one, like the fourth one's the one that got them, or the third one, and then they start developing symptoms. And then the other problem is obviously like sometimes they're dormant for a year or two. Like you'll start seeing symptoms a year after, 2 years after. Yeah. So it is extremely hard to like pin down if you're going to have a problem in the future, and if like, because obviously if you knew you were, you could get treatment before you start showing symptoms and sort of get through it. But
exactly,
unfortunately,
that's the $1 million question though. And like you brought up a good point too, where it's like cumulative trauma, for sure predicts PTSD. And then also like even in deployment, I'm sure like the first 18 years of life, there is stuff happening. And we've shown in some of our studies that childhood trauma is one of those big significant risk factors for future PTSD. And then even go back, in utero, was your mom using substances, or was there different environmental stressors? So like you're walking into that, deployment with this long history that could even make you susceptible before you go on that first one.
Without even showing signs.
I
actually had a conversation on a podcast recently where one of the guys was saying like, I thought all my PTSD was from the war, right? Like Iraq, Afghanistan, dude deployed like 7 or 8 times. But like he got into it with a therapist. Finally, he was one of those guys didn't want to look for help or ask for it, but he finally got the help, and it was all from childhood trauma.
For sure.
So like he kind of got all that off his chest, and then the combat stuff didn't even bother him.
Wow.
Yeah, wild. Absolutely wild.
Wild story. Yeah, I mean, just goes to show anytime the brain is developing, it's so sensitive.
Yeah.
It's fascinating.
One more?
Sure, yeah.
What don't we know yet about long-term cannabis use and brain health in people already dealing with PTSD?
Yeah, that is hard. I think there's a lot of different theories about it, right? Some folks will think, who study more like animal models, that you get some immediate kind of symptom relief, right? And there's a mechanism we know that happens through this endocannabinoid system. So people get into kind of the habit of self-medicating.
And then from there, you kind of develop a tolerance over time. So you still need it for your medication, but you're not having the same kind of physiological effects. So and this hasn't been shown because there haven't been any studies, like maybe you get better within the first 3 to 6 months, and then you kind of go back to baseline after that. And then there's a whole other aspect of you can get quote unquote addicted to cannabis. Like cannabis use disorder is a diagnosable disorder. It's a subset of people who use, but there's a lot of variability in how people use. And there's been a couple studies where they have people who are very heavy users or with cannabis use disorder, and they opt into coming off the cannabis, and they actually see that their symptoms go down. So it looks like it's very complicated, like a lot of things. So.
Very like one person like specific, and then the next person could be totally different.
Possibly, yeah. And there's also like 6 million ways to have PTSD, right? Like people don't look exactly the same. So we're treating different things with different medications too.
Yeah, well, you have your work cut out for you.
Well, you guys do too. Thank you for doing the good work of sharing this research.
Hey, we want to end veteran isolation, and you guys want to help vets, not have PTSD for the rest of their lives.
So, well, if there's ways we can support you guys, please let us know. We're happy to have you and advocate for whatever you need.
Yeah, well, thanks for coming on, and we appreciate everything you're doing.
Thank you. This was fun.